last time I was here, I was talking something more technical, more medically technical. But today we'll be talking something more nuanced, something that it is important, but it doesn't focus on the particular aspect of health, but looks at everything in total. And that's mind and body and the global majority community. We're looking at a holistic approach to health and well-being. So there's so many things to unpack here. Um, First is, what do we mean when we say mind? What do we mean when we say body? What's the global majority community? Uh, what's health and well-being? And how do we adopt a holistic approach to that? That's what we'll be hoping to cover today. And these are very beautiful faces of what we call the global majority community. By way of introduction, when we're talking about the global majority community, we're talking about people of non-European descent. And it's the global majority community because that constitutes the majority of the world population. Between 56 to 62% of the global population are of non-European descent. And that is expected to rise to as much as 70 to 80% in the next 20, 30 years. So the overwhelming majority of the world uh, um, uh, non-European in descent. And that's what's non the global majority community. So now that we've established that, so we're looking at most of us fall into this category, and most of the people will know will fall into these. So how has mind and body in these individuals, how does it come into play when we talk about people's health, when we talk about people's well-being? Somebody will ask, what is health? We can describe health as not just using the WHO, the World Health Organization definition, as not just a state of physical or mental well-being, but a complete state of physical, mental, psychological, and social well-being that doesn't just talk about the absence of disease, but also talks about preventing disease, as well as optimizing people's health in work, in society, and in relationships. So that's what health is all about. It's not just someone hasn't got particular disease condition. That's not health in itself. That's just a medical aspect of health. When we say someone is healthy, we're saying they haven't got a disease. They don't have the conditions that will make them develop a disease, or if those conditions exist, those conditions are well managed. Um, and then they are functioning the best way they can in their place of work, in their relationships, and also in their social life. So it's really important to look at health in that in that context. Now, I mentioned something very important in the introduction. I have an interest in occupational medicine. And so, just a bit of that, occupational medicine talks about the interaction between health and work. We know that work is very good in terms of health. You're more likely to be healthy if you're in active work. But we also know that a significant amount of health conditions are linked to work. If you do certain jobs, you're more likely to get certain diseases. As an example, we know that people who work as miners, for example, are more likely to have lung conditions. They're more likely to have certain kinds of lung cancers. We know also that people that do shift work are more likely to have mental health conditions. So that tells us that the work we do does play a role in our health. And I'm actually interested in finding out if certain people should actually do certain roles or not. But that will be a discussion for another day. So we've established what the global majority community is. We've talked about what health is. What do we mean by well-being? Is health the same as well-being? Yes, they're linked, but not exactly the same thing. We mentioned that health is about the complete state of being in good condition mentally, physically, and socially. Well-being talks about the awareness of being in that condition. So someone could be healthy in quote in the sense that they've got all the available parameters of being in a good state. They've got all the available parameters of not getting sick, and they've got all the available parameters of functioning the best way they can at work, in their social life, and in their relationships. But then they might not have that awareness, and that absence of awareness or that presence of awareness is what we call well-being. I'll give you an example. You could wake up in the morning, have no other underlying condition, but then you receive, let's say, an unexpected news. You're healthy in the sense that, let's assume the news hasn't made you anxious or made you low in mood, but you receiving that particular news affects your well-being in the sense that you will not feel that you're at the best level of functioning, or you're in the best state at that point in time. So that's your well-being, even though it hasn't changed your health. So you didn't overnight develop hypertension or diabetes, but you could decide on that day that you're not going to be able to work as much as you ought to. Or even if you go into work, for example, you're not able to perform at your optimum best, even though nothing has changed between the day before and the present day. The only thing that has changed is the fact that the state in which you're in, because of maybe what you've heard or what has happened, has affected your well-being. So your awareness of being healthy has been affected. And that's where health and well-being comes into play. So it's one thing to be healthy or wanting to not be to be in a good state physically and mentally. Is another thing to be aware of that state and to be aware when you've moved away from that state. Because if you're aware that you're in that state, then you will know what to do to make sure you maintain yourself in that state. And if you're aware you've moved away from that state, you'll know what to do to ensure that you go back to a state of health. So that's where well-being, that's what well-being is, and that's how they are linked. Now, mind. What does the mind talk about? The topic is mind and body, and the global majority community, a holistic approach to health and well-being. So, what's the mind? To put it simply, the mind is the sum total of all our being, all of our thoughts, all of our emotions, all of our consciousness is the mind. Where is the mind located? Yes, the brain plays a key part in the mind, but the mind is beyond the brain. The mind is that series of influences that acts on the brain to create a state of consciousness. So that's the mind. Excuse me. So what's the body? The body is that physical component of every individual. The body is what we see. The brain constitutes part of the body. Our hearts, our flesh, our sizes, our weight, all of that, blood pressure, all of that makes up the body. We all know how they interact. The mind is situated within the body, but transcends the body. And so anything that affects the mind affects the body, and anything that affects the body affects the mind. And we mentioned that when we say someone is healthy, we're looking at mind and body in total, and both of them are in a good state. So now that we've established the basics of what health is, what well-being is, what the mind is, what the body is, what the global majority community is, what then is holistic health? When we say we're looking at health holistically, what do we mean? Why is it different from health as defined by the World Health Organization? Holistic health, when we say we're looking at health holistically, we're mentioning a focus on the whole person. If we take a note there's body and mind. But then if we're talking about health holistically, we're also considering things like the spirit. We're considering things like people's belief, people's culture, people's spiritual well-being. All of that feeds into holistic health. Now, this concept embodies I would say, a movement away from the medically centered idea of health, which many of us consciously do and consciously practice. Of course, in my line of work as a primary care physician, I see patients. The first thing is medical. Then we talk psychological. Then we talk environmental factors that affect their health, and then occupational. When we're talking about holistic health, we should be conscious of people's spiritual conditions. We should be conscious of people's cultural backgrounds. I'll give an example. For we are Christians, uh, or most of us will be Christians in this platform, I believe. If we were to, if and we have got different Christian beliefs. Some of us, for example, have got very strong beliefs about and strong feelings about abortion. And so, if two people are seated in front of me, one is a Christian who has very strong beliefs about abortion, one is someone who doesn't have those beliefs about abortion, and we're talking about having a baby, for example. Now, there are two people, we're talking about the same thing, but if I'm going to talk about health holistically, I have to take into context what's the spiritual inclination of the person sitting in front of me. And it will be wrong if I'm going to practice health holistically to even want to begin to broach the topic of abortions with someone whose spiritual inclination does not allow it. Now, that's holistic health. Because if I were to do that, that could offend the person deeply, that can affect their spiritual beliefs, and that can have an effect on their physical health. Uh, and so understanding that is very important in terms of managing health holistically. Now, it helps us to be able to know that health goes beyond blood tests, goes beyond physical things that we can see, but also involves things that we cannot see, things that we cannot put a measure on. You can't put a measure on someone's culture. You can't put a measure on their physicality. You can't put a measure on their you can't put a measure on their spirituality. You can't put a measure on their culture. You can measure their physicality, but the other bits you can't measure. But those other bits are important. Um, Another thing I would also want to bring into this, looking at health holistically, is certain Pentecostal Christians speak in tongues. And so if you do not understand that and you see someone speaking in tongue, you could begin to believe that the person was saying things that there's a name for it in psychiatry. You could say the person is having some word salad or echolalia, but then if you are in tune with the spiritual, you would understand that this person is manifesting his spiritual state and could be in a far better health than you, who is trying to place a name on expression on the spiritual nature of what the person is doing. So that's what holistic health is about. And in our line of work, we need to begin to look at things in that aspect. When we see people as medical personnel, it's not just about the physical state, their environment, their social status, their economic status. We need to begin to consider their culture and their spirituality if we want to practice health holistically. Um, so we've talked about what the global majority community is, and it's very important because culture plays a key role in the health of the global majority community. Our experiences matter a lot. Our cultures matter a lot. We are defined by our cultures largely. And in Western societies where there is a focus on Eurocentrism or there's a European focus on European cultures, looking at people from the global majority community within or using those lenses, those European lenses, will mean that we will do great harm to their health or great harm to our health. For example, the village square is a very powerful concept in African culture. And so, if you take a man who has spent all his life in that kind of setting, where the village square is a very powerful setting, and you bring him to a place where he's every man to himself, which is largely what happens in Western society, you would notice that the person withers mentally, withers psychologically, because that aspect of his culture has been taken away from him. A good example is last year, I brought my mother over She came visiting, and after a couple of months, she wanted to leave. And of course, it was obvious that it wasn't because there was anything wrong with the place or it wasn't anything wrong with her physically, but she felt drained because this is a woman who, an active member of her church, active member of her community, gets involved in community work, gets involved in community project the African way, the village square way, like I say. She wakes up in the morning and she's off to her neighbors. They're organizing this. There's a wedding to organize. There's a family to visit. There's a new baby that has been born that needs to be that needs to have a bath. So that constitutes her life. Now, bringing her here for 2 months, she felt quite lonely. She suffered. And that was because of the setting, the cultural setting she had grown up. Now, for many of us who have become resident in these communities, we are experiencing some sort of those conditions that's affecting our health, but we're not aware of it because it is not part of what constitutes health within the European setting. So a man goes to his GP or sits in front of me and tells me my mental health is suffering. Now, the first thing I'm looking at is, oh, what has happened? Is he going through some stress at home? Is his work stressful? Has he had an abusive relationship? Things like that. Those things are good, but we also need to ask, where did this man grow up? What has happened to this man 10, 15 years ago? What kind of environment did he spend his early years, his formative years? When we begin to explore that, we'll better be able to know how to help this individual. And so that's why it's important to explore these things, to look at this approach when we're talking about holistic health. Now, I've talked about how health is more than the absence of illness, as well as the prevention of disease, but a, a more composite state of mental, physical, and emotional well-being. And we've talked about the uniqueness of the cultures and the wellness of the global majority community. Another example I like to bring when I talk about this is um, if you, I've mentioned the village square paradox of the African culture. The Chinese, for example, have a very tested, long culture of Chinese medicine, which very effective for many of them. But because there's not much Western research on that, if someone comes to me and sits in front of me and tells me, oh, I've got this certain condition and I'm taking some Chinese medications, the first thing that might come to the minds of many of us will be, oh, why are you taking that? There's no medical evidence to prove that. And so I doubt this was working for you. Do you want to take this, and this, which there is mountain of evidence to show that it works? Now that approach helps, but it misses the point that we need to situate this individual in the cultures and the communities they're coming from. We're saying that research that has accumulated over, at best, 200, 300 years should take precedence over centuries or millennia of practices that people have done and have worked for them, simply because we haven't been able to research those practices and we cannot support those practices. We should play with those practices and just go with what we can support. That again negates holistic health, because if we're going to practice health holistically, then it's to explore what this person is saying. What exactly is this traditional medications you're talking about? Where did they come from? How has it helped you? Can we see, is there a way to see if it's actually doing what it's supposed to do? And by doing that, we might find out that we give people control over their health, and then we help people in such a way that their health is not looked at from just a medical point of view, but their health is looked at in a holistic way. And by doing that, we tend to get better outcomes from people in terms of compliance to whatever treatment plans we have, as well as outcomes generally. So this is us. This is someone, or this is all of us basically, this is all that fits into our health. We can see here a lot of this is physical: the brain, the bowels, the intestine, the heart, the mental state. But then there's the nervous system, which is physical in itself, but then that houses the mind. And then you've got concepts like mindfulness. We're beginning to see in the last 30, 50 years, for example, that there's a realization that certain things that you cannot prove by research, for example, you can't have conclusive evidence by research, actually works if you look at the evidence of what the people who are using them are saying or feeling, rather than looking at certain physical parameters to check if they work. So you have things like people practicing yoga, people practicing mindful meditations, for example, and these things are working. But these things are things that have been done for centuries by people without any specific medical research to back it up, and has been working. But suddenly, in the last 20 years, we've suddenly realized, oh, actually, this works simply by listening, simply by considering that the European standard doesn't necessarily have to be the right standard at every point in time. And there are other standards that different cultures have used for ages and has worked. And so that's the mindset that we should propagate as members of the global majority community in our different places. So when we're doing research, for example, we shouldn't look at that research from the point of lens of the 200 or 300 years of European research. We should go beyond that. We should ask ourselves, this research, how does it apply to someone who is in Ghana, for example, who was born in Ghana, for example, who has different experiences in Ghana? Does it apply? Now, it's really important because we've been talking about all of this. When we're talking about the health of an individual, it's not just the genes, the medical care. It's not just health, behavior, environmental, social characteristics, which at the moment, this is the best approach to healthcare that we have in the medical world. We've gone beyond medical care now. We're looking at things like health, behavior, environment, social characteristics. But if we're going to go that step further to holistic health, we have to involve things like culture, like I mentioned, spirituality, like I mentioned, that has to fit into these social determinants of health. And so, as people who are conscious of this in all that we do, in our seeing patients, in our research, in our medical work, in our teaching, we should ensure that we're looking at things beyond the lens of what we have been structured to look at it based on our training in Western ways. We should look at it from the lens of what has happened over the last 2, 3, 4, 5 millennia that the world has existed. There are other people in the world beyond Europe and the Western world. And these people have cultures, practices, and also systems of health that can be beneficial to everyone. And by listening and trying to explore that, we will more likely push the boundaries of health for everyone. And by ignoring that, we'll be doing more harm than good. Now, in medical care, I will say a few things about this. There's an underrepresentation of the global majority community in clinical trials. Most of the trials that was done in the last, it's changing now, in the last 100 years, was done predominantly on European centered, or was a European centered. At most, there was a slice of Asia, which in that instance wasn't even China, but more of Japan and Southeast Asia. Now, so all the evidence that we're using to prescribe, that we're using to treat people, did not actually involve many of the people we're treating. A curious case of that is, although that's changed recently, hypertension, for example, which I talked on the last time I was here. How you treat hypertension in a Black person is very different from how you treat hypertension in a white person. But then that was something that was realized about 30, 50 years ago, because there was that experience that Black people weren't responding to the standard medication that a white person would respond to. And by understanding this fact that many of the research materials that are currently being seen as gold standard underrepresent the global majority community, we realize that we might be doing some harm to the health of people in that community by not listening and exploring their own type of healthcare or experiences when we're treating them. And also, we should note that the present medical care downplays the role of culture in healthcare. So, if, for example, I see someone from Ivory Coast, for example, um, who or Sierra Leone, who has a strong connection to the Marabouts. So historically, there's certain peoples in those areas who everything goes through the Marabout. The Marabout was the village medicine man. If he comes to me, for example, and I tell him, "Oh, you've got cancer," and he tells me, "Before I accept your diagnosis, let me consult my Marabout." More likely than not, there's a tendency for us to look at him and say, "I've told you the results are clear. You've got cancer and you're telling me about consulting your Maraba. Are you really understanding what I'm saying? Do you really get the implication of this?" Or more likely going to document that this patient declined treatment because he says he was going to consult his Maraba. Now, that is a typical setting of the present medical care that we run. And that's because we downplay the role of culture in medical care. Now, that person is more likely to believe what his Marabout says than what I said. And it shouldn't be a problem. It shouldn't be an affront to medical care. It should be a route for collaboration. In an ideal world, he tells me he wants to see his Marabout. I say, okay, that's fine. Can you let me know what your Marabout say? Can you give him these details? And can you also let me know what the plan is from him? Now, that way, we give him the options. It's possible that his Marabout will not be able to solve cancer, but by allowing him know that him speaking to his Marabout is not out of place, that allows him to be more willing to listen to what I have to do or what I will offer him in modern medical treatment. And that's more likely, it's going to be more likely that he's going to comply with the treatment plan and will get a better outcome than if we insist that it's a either medical care, ignore your Marabout, just focus on what we tell you. He might do that, but the outcomes will not be as good as it ought to be. And then he wouldn't do that wholeheartedly, and it would be defeating the purpose of holistic health. Also, we medical care hasn't caught up with understanding the millennial of adaptation to the environment compared to the few centuries of migration. What we see at the moment is, yes, we see a diverse multicultural world, but then that has only happened in the last 200, 300 years, at best, maybe 500 years. But the world has existed for millennials before then. And the ancestors of the people who are living in a multicultural society had existed for centuries before them. And so they've passed across certain genetic components based on their environmental changes that they had been subjected to for a longer time than what we see now. A very simple example is, as a Black person who lives in Africa, for example, when you get malaria, you're less likely to die than if you're a white person who goes to Africa and you get malaria. Same disease condition, same organism, but then the outcomes are going to be vastly different. What's the reason? Centuries and millennia of Black people residing in the malaria belt means that their bodies have evolved in such a way that malaria doesn't do as much harm to them as it will do to someone who is in a climate that has never had that exposure to to Plasmodium, which is the organism that causes malaria. Another example is vitamin D. Vitamin D is a vitamin that we get from the sun. Now, vitamin D is very important for bone health. It's very important for mental health. The Black skin, for example, predominates in the tropics. Now, that's not a problem for vitamin D because you've got lots of sun. So that sun is enough to overcome the Black skin and give you vitamin D. Now, you come to a place where you don't have enough sunlight, but you've not lost your dark skin because that dark skin took ages and ages to evolve, but then you've only spent maybe 200, 300 years, maybe at best, if you're 3, 4, 5 generations were born here. You haven't had enough time to adapt. And so vitamin D deficiency, for example, is more common in dark-skinned people for this simple reason. We can measure it, we can test it, and we can explain it. But these are two examples that shows us that where people have come from plays a very important role in their health, plays a key role in their health. And we have to understand that if we're going to be able to treat them more. Another example is prostate cancer. If a white person, a white man gets prostate cancer, it's more likely it's going to be mild, what we call a low grade cancer, in the sense that it's more likely not going to cause much problem. It's more likely going to be early stage, it's more likely going to respond to treatment. But if a black person gets that, the cancer is more likely going to be aggressive. It's more likely not going to respond to treatment. Now, these are inbuilt changes that it doesn't matter if this black person is in Ghana or this black person is in the United Kingdom, these facts remain. And so, in our understanding of holistic health and the global majority community, we have to understand these very important differences. Now, we've talked about this. This picture is what will be the perfect healthcare system. If you have a look at what you can see there, you can see on your left, you can see a black person. On your right, you can see an Asian person. If you have a look at the setting there, you have the more traditional ways of healthcare. You've got him sitting in his comfortable way without clothes on his back, which could be a man somewhere in the village in Nigeria or in a village in Brazil. This is usual environment. If we have a look, there's some bit of modernity there in the sense that we can see he's got some modern facilities there. We can see he's got medication. There's actually medications that you can see in the background, which are modern medications. But then he's also got his traditional medications, and they are coexisting side by side. And he's got nature in front of him. He's not boxed in some urban jungle where he's not allowed to fully express his culture, but he's one with nature in a place where the modern meets the traditional, and he's more likely to excel in that kind of environment. On the right, we see an Asian woman. You can see medications on her right, some traditional, some modern, and you can see that oneness with nature. So this is the perfect image of what health means for the global majority community. The man who is a great grandson of the deer hunter suddenly comes to an environment where he cannot hunt deer, and we expect his health to be perfect, there's going to be a problem. The man whose ancestors spent ages or spent most of their time having a chat in the market square comes to a place where he cannot talk to his neighbor, and we noticing that there's certain challenges with his mental health, certain challenges with his achievements, his outlook, and we're concerned, we're surprised. That's because we haven't taken into cognizance that we cannot take away the ages and ages and ages of changes that has been passed down to this individual, despite the fact that he's in a different environment. The environment from which his ancestors came from is definitely going to affect him. Now, what's the current state of play in terms of healthcare? Why do we need to begin to shift focus to a holistic approach that involves culture and spirituality? As a black woman, a black woman is 4 times more likely to die during childbirth than a white person in the UK. I'm talking about being exposed to the same amount of the same healthcare system. The results are significantly different. 40% of South Asians South Asians have a 40% higher chance of dying from heart attacks than a white person in the UK. Black Africans and Caribbeans are 8 times more likely to suffer from certain mental health conditions compared to white people. And as a Bangladeshi person, a Bangladeshi man is likely going to live 10 years more of his life in ill health than a white person. So the average white person will have about 65 to 70 years of good health. The average Bangladeshi, it drops as low as 50 to 55. Well, I mean, average, I mean, the people, half of the people will have less of that, half will have above that. Now, the question is why these disparities? They cannot be explained solely by the fact that these individuals, by the color of their skin, because they're exposed to the same healthcare, they're exposed to the same environment, they're exposed to the same system. We have to begin to look beyond the physical and begin to talk about people's culture. Of course, the black man whose ancestors had that markets, had that community market, as well as that public square gathering or the village square gathering, was more likely that's his way of coping with mental health, with his mental health. It comes to a place where that is lost. Obviously, he's going to struggle because we haven't taken away that what has been passed on from generation to generation, and he's yearning for that kind of environment. And it's really important for us to understand that. Again, we can see COVID-19 deaths when it comes to racial disparities. This alone cannot be explained by race. So we see that if you during the peak of the pandemic, Black people were more likely to die from COVID-19 than white people, and so also for Hispanic or indigenous people in the United States. So to summarize, what are the benefits of a holistic approach? Improve physical and mental health outcomes for the global majority community, greater cultural empowerment and community resilience. People feel empowered. People feel ownership of their healthcare. Uh, Again, it's no secret that there's generally a suspicion from minorities when it comes to healthcare of no fault of theirs because of years and years and years of systemic injustice. Now, one way of overcoming that is allowing people's cultures and people's spirituality and people's communities to be involved in health making decisions. Like I mentioned, for example, there's nothing wrong with a man wanting to consult his pastor, for example, before making a decision whether to go on with healthcare. There's nothing wrong with somebody wanting to consult his village oracle before making a decision about his healthcare. That should be part and parcel of what we consider as healthcare. And it also ensures patient-provider relationship. So that suspicion about I'm not sure what is being offered to me, we can overcome that by ensuring that we take a holistic approach, like I've discussed. So this is a call to action. We are all ambassadors to this goal to encourage equitable health policies. Wherever we are to be conscious that the European setting of healthcare does not have it all and does not answer all the questions. And so at every point in time, we have to keep questioning what is assumed to be the right thing. We have to keep interacting with what the evidence says rather than just accepting the evidence and going with it. We have to also make sure that we support culturally sensitive wellness programs. So yes, yoga and meditation is good, but does that tie into the man whose ancestors never meditated? Does that tie into a man who was the son of Sierra Leonean immigrants? Is that the way to get the best out of his mind? That might work very well for someone who is Asian, but does that work for someone who is black? The person who is black might benefit more from a village square kind of setting where he's able to meet pals, have a chat with pals, talk about the harvest, talk about work, talk about things that are happening in the community. That might do more good to him than yoga, for example. So we need to make sure that, yes, we're trying to improve wellness, but it has to be culturally sensitive. And a one size fits all doesn't work for everyone. We also need to embrace a holistic mindset in personal and professional spaces. So we shouldn't look down on people when they bring culturally relevant things to the workplace, or spiritually relevant things to the workplace, or spiritually relevant things to their professions. Rather, this should be encouraged because that's the only way to make sure that we get the best out of everyone for everyone. And when we do that, everyone is happy. Beauty about holistic healthcare that combines everybody's culture and spirituality is that it doesn't affect anybody. if you don't belong to a global majority community, then no one is imposing their cultures or their spirituality on you. And if you belong to a global majority community, yes, your culture and spirituality is welcomed. Your environment is taken into consideration. So everybody thrives, everybody's happy, and we'll have a more just and equitable world. Thank you.
Thank you so much, Dr. Yahaya. Amazing. Dr. Yahaya is the primary care physician and health economist with interest in Oki health. And tonight we looked at the topic body, mind, body, and the global majority community, a holistic approach to health and well-being. I notice you touch a lot about the spiritual side of being the holistic, and it says spiritual belief plays a significant role in holistic health, shaping how individuals and communities approach well-being. Thank you so much. Is there anyone who would like to ask any questions? We've got some in the chat box. Please feel free to raise your hands and comment, conversation, please. Thank you. I'll open that first. If not, we'll go on to some questions in the chat box. This is someone asking, many people have slumped at work. What symptoms should someone be looking at to stop?
Okay. So it's this is something that's very common in Black people, for example. Most of the people that slum from two reasons. One is that they've either had a massive heart attack or they've had a massive stroke.
Mm.
Now, Black people naturally, in my last talk last year, I mentioned we're more prone to having very high blood pressures. But then again, we're scared away from seeking healthcare because of a lot of things about what we talked about. If we involve people in their healthcare, there's no reason why I cannot go to my church and take my blood pressure. There's no reason why I have to go to my GP to take my blood pressure. Now, if that's the setting, what it means is we're more likely going to get more people know their blood pressure early, take steps to get treatment, and avoid them slumping. But because we insist that it has to be with their GP, who they're afraid of going to see, they don't go to see him. The blood pressure is too high. One day they have a massive attack and a stroke and they slump.
Thank you so much. Another question. For how long can someone use a particular medication continuously?
Okay, so it depends on what the medication is for and the side effects of the medication. So it varies from one medication to the other. Some medications are meant to be used for short term, some are meant to be used for long term. So it just depends on the type of medication you're using. But the key thing is, whatever medications you're using, make sure it's been monitored. I use this as I say jokingly. I say that's one thing that modern medicine agrees with traditional medicine. When you go to see the herbalist in those days, he will tell you after 6 months, come back, let me see you. So also when you go to see your doctor, whatever medications he gives you, you need to go back to check what's happening with it.
And here's another one. Many of us are used to herbs to treat malaria, for example. Sometimes we are tempted to use it at the same time with Western medicines. What's the likely implication?
Okay, so this is a very good example. The medications we use to treat malaria, for example, all of them came from herbs.
Yeah.
Artesunate was a Chinese herb. Chloroquine is a herb. So most of the herbs we use, yes, have malaria treating properties. Like we said, for centuries, our ancestors had been treating malaria before Western medicines came. So yes, they have these properties. But then, like with everything, you shouldn't use a combination of different things. Whatever you're using, be open to your doctor, discuss about it, explore it, and then you can decide what's best for you.
Hey,
Can I quickly say something?
go ahead, Tony.
Can I quickly say something? Doctor, if you said we should discuss with our doctor, My doctor, for example, is not likely to know anything about ewuro, bitter leaf, which a lot of us believe um, is something that cures malaria. So if I discuss with him, he's not likely to understand what I'm talking about. So where do we go from there?
So I think that's why the talk is here for, sir. It's our job to make him aware that, like we mentioned, our ancestors have been treating malaria using ewuro for ages, and it's worked. It's his job. If I were in his place, it's his job to understand, what does this contain? What does this bitter leaf contain? If he's really curious, he could do little research, go online, find out what it contains. Does it have any significance to modern medicine? Half of the medications we use today in modern medicine were from herbs. And so any doctor who is actually worth his onions will not dismiss you and say, oh, why are you using bitter leaf? If you've mentioned it, I want to find out what's in bitter leaf. Is it similar to what I'm giving you to treat whatever conditions you've got? If it is, then I wouldn't say, oh, stop using your bitter leaf. No. What I would advise you is make sure the bitter leaf is working. This is what I'm looking for. If, for example, you had malaria 3 days ago, you had a temperature, you use bitter leaf, you come back to me and you don't have a temperature, I'm not going to insist that, oh, because you didn't use Western medicine, even though you don't have a temperature, you must use Western medicine now. That would be wrong.
Okay, I have one more question, please. You said something like that when we talk about prostate cancer, that it's worse within the Black community than the white community. Why is that? Is it that because the Black man does not check and the white man checks, or what? Why is it? Why is it like that?
There are a few reasons that research has shown. One is, now, the prostate feeds on testosterone. In Blacks, testosterone is much higher than white people. That's one reason. So it's more likely that because of the higher levels of testosterone, which the cancer feeds on.
Sorry, please, doctor. For the purpose of a lot of us, what is the meaning of testosterone?
Okay, so testosterone is the male hormone. The reason why we've got beards, the reason why we are thick, the reason why we are big as men, the reason why we're able to perform our function as men is because of that hormone. That's the male hormone, testosterone. Women have it, but in smaller quantities, but it's the predominant male hormone. Now, what that does is it's what keeps the prostate functioning, keeps you having beards, stops you from having the female breast, stops you from having the characteristics that a woman would have. Now, that's what it does. But because the prostate feeds on it, there is that belief that because of the levels are higher in a Black person than a white person, that could be the reason why prostate cancer is more aggressive. Now, this is also believed to be part of the reason why, if, for example, you were to, again, I believe everyone on this platform is as an adult, if you were to take average measurements of the male genitalia, the Black people or Black men have bigger genitalia than white people. That's research proven. Now, that's again because of testosterone. So there's a positive effect of testosterone, but once it comes to prostate cancer, that testosterone simply drives the cancer to be more aggressive. That's one belief. That's not one belief, that's one fact. Another thing is there's also research that shows that our genetics, so our genetic input or our genetic makeup as Black people means we're likely going to have a bigger prostate that's rapidly dividing. So that increases the chance that a prostate cancer in the Black person is going to be more aggressive than the white person.
And Telma asks, why are the hormones more in Black than white?
Okay, so again, different reasons. One, the racial composition. There are certain hormones that are more in Black people and certain that are more in white people naturally. And the reverse is the case. We mentioned something, for example, if white people, for example, are more prone to autoimmune conditions, you're more likely going to have rheumatoid arthritis, for example, the white person and the Black person. These are inbuilt differences. So the fact that our races are different also means we have some of these inbuilt differences. So Black people have got higher levels of certain hormones, while white people have higher levels of other hormones. So testosterone is just one of the hormones that Black people have higher levels of. There are other hormones like bradykinin and other things, which I won't bore you about, that white people have higher levels of and that cause other things.
Yes, thank you very much, Dr. Yahaya. I'm not surprised when you came before now. The feedback I got was that it was very educative. So what we have had again tonight, I've been getting comments from people that are saying that they enjoyed it. And on behalf of every one of us, I want to say thank you. In particular, I mean, I picked up a few things there. You've been able to break down what health is holistically and how culture plays a key role in these health matters. You also gave a personal example, which I mean, I've witnessed also of, I mean, a fairly old man that came here and couldn't settle down. In fact, he went back 2 months earlier than he should have traveled because he couldn't settle down into the system here. The man, a very strong man that was never falling sick. Here, he had series and series of sicknesses and he had to go back home. And as soon as he got back home, he was fine. So that is to prove that environment or culture has effect on our health. And I think a lot of us will now understand this, so that when these old people come, we don't think they're just complaining for nothing or that they don't have any reason to complain. So thank you very much for that. I'm also happy to hear that there seems to be some kind of cooperation now between the Western doctors or practitioners with those that we want to consult either with their pastor or Babalawo or whatever they want to consult to confirm what the doctors have said. I'm happy that you are not being hostile to them, but you find a way of getting these other consultants out there in quote, you know, to understand that, okay, let's work together. The important thing is for the good health of this person. So I want to say thank you on behalf of every one of us. And I also want to say thank you to those of us that have joined. I want to believe that we have gained a lot from Dr. Adaya. We may not all have the opportunity to say thank you, but I know that deep inside you, you are taking a lot home. So once again, I want to say thank you on behalf of Dr. Abiola that is on here and our beautiful host, Madam Olga, who has recently received an award. On behalf of all of us, I'm saying thank you to you, and I say more grace and more grace. Thank you once again, and God bless you all.